Okay, so Dr. David here. I want to talk a little bit about your diet. Once you've gotten the diagnosis of cancer, you're being treated for cancer, you've got to start making changes. There's no question about it. Even if your doctor doesn't tell you, you should know. You've got to start eliminating some things. The easiest things, the most obvious, are processed foods, sugar, highly starchy foods, fried foods, very salty foods, anything that can increase your inflammation levels. Because what inflammation does, usually that's really a risk factor for heart disease and for cancer. And by the way, they're seeing genetic connections between heart disease and cancer now. But what inflammation does is that it encourages the spread of cancer throughout your body. So the first things you want to do is that you want to reduce that inflammation through the foods that you're taking. You want to take more cooked, more boiled foods. Obviously, you want to take a lot more vegetables. Obviously, you want to avoid fried foods, like I've said. You want to avoid all this junk foods. I mean, usually junk food just maybe once a week or once a month. But now that you have cancer, forget about it. Don't do it. Just stay away from it. Okay. There are other things too that we'll be discussing. I had Tony Fowler and I sat down and we talked about what she's doing. I think she has stage 4 breast cancer, but she has had a remarkable turnaround, remarkable in every kind of way. She's lost weight. She's adjusted her diet. She's always had a good attitude. So that was in place. She's doing all the right things that need to be done, but she's lost like 50 pounds. So these are things that you just have to be aware of. And unfortunately, they're not being talked about as much. And so that's why we're trying to say these things so that you can be aware of them. So stay tuned. Follow us on Facebook, LinkedIn, and YouTube and all that. We're going to keep on putting out this information throughout the month of October on breast cancer. Take care. Bye.